So, good afternoon, everyone. Once again, my name is Clinton Green. I am the program director of our Thrive at Work, a peer training program here at Community Access, and I am your MC for this event. So, welcome to the 2017 New York City Youth Mental Health Symposium. Community Access is proud to host this day-long conversation about youth mental health in New York City and beyond. We hope this forum will be the springboard for progress in the vital areas of adolescent, teen, and young adult mental health. We have a packed room here live for this event, and we are thrilled to also be streaming worldwide. Thank you all for being here. Time permitting, we'll have a Q&A session following this presentation. If you are joining us online, feel free to send in your questions throughout the discussion. It's now my pleasure to introduce our next presentation on mental health in non-majority communities. So welcome, Mary Adams, Managing Director of Mental Health and Wellness at The Door. The Door's mission is to provide comprehensive youth development services in a caring environment. And Mary is a social worker with over 20 years of experience developing programs that serve children, adolescents, families, and young adults in New York City. We also have Justin Barron, Director of Blueprint Supported Education here at Community Access. Blueprint supports the education goals of current and prospective students with mental health conditions. And Justin has 7 years of experience in community-based mental health services. Also want to welcome Shalina Hopkins. I am so sorry about that. Program Director for Community Access. Shalina joined Community Access in 2016 for a youth-centered supported housing facility and has over 15 years experience in the human services sector. And lastly, Brett Sharretts, mental health specialist for the Forney Center. The Forney Center provides individual therapy to homeless LGBTQ adolescents ages 16 to 24. And Brett is a licensed master social worker with experience in inpatient and outpatient settings throughout New York City. So thank you and welcome, panel. So each of our panel members is going to have about 3 to 5 minutes to tell their story. And I guess we'll start with Mary.
All right, First, I just want to start by saying thank you. It's just a pleasure to be here to talk about this critical, this important subject of mental health with young adults and adolescents and young adults in New York City. I think probably everybody in this room understand where the gaps are and how much work still really needs to be done for our young adults in the city. I'm the Managing Director of Mental Health and Wellness at The Door, and as such oversee mental health services that are integrated into all of our programs. And so as I say that, I'm describing the Door Center, which is a standalone young adult center in Soho. Ironically, we purchased that building years ago when nobody would have had real estate down near the Holland Tunnel, and now have a huge youth center serving over 10,000 young adults in New York City a year at that center. We have gradually grown from a smaller youth center to provide a full, comprehensive range of services that includes a lot of career and education programs, an adolescent health center, a counseling department that provides mental health services. We have legal services predominantly for young adults that have issues with immigration, lots of arts and recreation, and I'm forgetting somebody. Oh, we're the drop-in center for runaway and homeless youth in New York City. So we have a whole host of programs serving 16 to 26 now. It's expanded over the years to serve older young adults. And as you can imagine, we see mental health needs in all of those programs. So The Door invested a while back in my position to say, how do we integrate and what are we doing to meet the needs, the various needs that show up in every single program that we serve. So I wanted to talk just a little bit about how we've done that and why it was necessary, and then how we've tried to respond to it, and then just mention briefly some of the gaps that I assume a lot of the people in this room know exist. We do low-level mental health stuff, right? Because everybody who walks through our door brings issues that any adolescent or young adult would bring. But because we're serving 98% of young people from our poor communities in New York City, they're also bringing a slew of trauma. And I think increasingly the world is more knowledgeable about what complex and what chronic trauma does to people, but we were seeing it live every day in all of our programs. So we're lucky enough to be a recipient of a Connections to Care grant, which is actually this mayor's Thrive initiative, which gives us some funding to integrate training and frontline training for all of our frontline workers, right? So they're being trained to screen our young adults with the ACE trauma, which is a trauma screen. It's a one-pager. Screen them for depression. We use PHQ-9, and screen them for substance abuse. So right off the bat, we're looking at young people and saying, we want to know who you are. We're not afraid of this, but we get that these things impact how you are as a young adult and how you move forward. And of course, these things impact them in the classroom and in every other aspect of their lives. But starting with that and training staff how to unpack trauma and problems gives us a stronger foundation to work with them and talk to them about not just mental health, but wellness. Yes, trauma impacts you. Yes, if you've witnessed a lot of violence, it makes you skitsy and it's difficult to concentrate in a classroom. And so, yes, that impacts whether or not you do well in education. So from there, we're able to also step our young people up to more focused mental health services. And we do have a counseling department where we have licensed LMSWs, LCSWs, providing more focused, real therapeutic services for about 1,300 a year individuals get mental health services, so come for therapy to us. Then we have our more seriously troubled young adults that are really showing signs of schizophrenia and more serious mental health conditions that they may not have showed a year ago, right? So they were okay, probably pretty bright, doing fine at grandma's house, and are suddenly sort of coming undone. And as most people know, these things just begin to show up in young adulthood and older adolescence. So it often takes people a minute to figure out what's happening. So we've responded to that by integrating an Article 31 satellite through our partner program, University Settlement, and we're able to address some of those needs. And then lastly, I think that we are maximizing some of the changes that are out there, like care coordination through Medicaid reform, right? So we're trying to provide more care coordination for our really vulnerable young adults who their mental health shows up in disorganization, they get kicked out of where they're staying. And so we're trying to maximize the different resources and systems that are out there. I'll speak just really briefly about some gaps that we've faced. And again, I don't think this will surprise people in the room. For young adults that are seriously mentally ill, we are the runaway and homeless drop-in center for New York City, and they come to us. They come to us from Forney, they come to us from Community Access, they come to us from everywhere. And there is not really a place to send them. Young adults that are 18, 19, 22 are different than a 42-year-old who's been on the streets for a long time and is suffering from serious mental illness. That population tends to be tied into care coordinators, to SSI. They know their resources. Young adults, this is their first time of falling through the safety net of schools, of foster care, of grandma's couch, of friends, and as they fall apart, they don't have the impulse control, they don't have the self-regulation, so they show up looking really messy. And so we see a lot of those young adults who need very, very customized, very intensive services, and that is really where our big gap is. And I think as much as we are really grateful at the door to have a lot of resources, have a lot of outside funding, and we've seen resources for mental health services increase, there are still gaps that we need to fill. So thank you.
Hi.
Sorry. I would like to take the opportunity to introduce another member of our panel. This is Kathy Wu, who is the Asian Outreach, who works with the Asian Outreach Program at the Child Center of New York City. So, Kathy, welcome.
So at Blueprint, we're also similarly trying to be keenly aware of the intersections of stigma and trauma and how these issues sort of inform and reinforce each other and overlap. Many of the students at Blueprint have first encountered mental health services through the criminal justice system, which has led to all kinds of negative impressions, not just of the mental health system itself, but the concept of mental health and wellness. And a lot of people have had very good reason, like people who have long histories of incarceration or involvement in the criminal justice system who are coming to Blueprint have good reason, based on their negative experiences, to hide the types of struggles that they're going through, and have wanted to sort of express things in different ways. So we are usually doing a lot of work with students to explore their rights in an academic setting in an institution around accommodations and the different types of supports that are available through, for example, the Americans with Disabilities Act, or things that you could access through a school's Office of Accessibility. The problem is that for many of the people who are coming, they are reluctant to identify themselves with having a disability, which is sort of the requirement and is the sort of dominant lens through which these types of accommodations and services are offered and procured. So we put a lot of effort into working with our students on understanding alternate ways to think about mental health. And particularly through, like what you were mentioning, as a trauma-informed perspective, so that people are not thinking about their experiences solely as a type of like biochemical issue that they're having with unknown etiology, but more like a reaction to a series of issues that they've encountered in their experience. We try to be as direct as possible when we're talking to people about what trauma really means in people's lives, so that we're not using, euphemisms about like, culturally appropriate services, but that we're talking about things that are directly meaningful to people, like the ways that they've encountered the violence of economic violence of capitalism, or their direct experiences of racism and dispossession, so that there's a common language that's upfront about what these issues really are, and that there's some benefit perhaps to looking at mental health through the lens of disability just for the purposes of procuring something like an accommodation, but that we have another type of language that we can employ to look at ourselves and look at a sort of system that creates these conditions to start with. So that's just, I guess, a little bit about what we do at Blueprint under the general heading of talking about non-majority communities and mental health.
Hi. So I am, the program director at a facility for youth. And like my colleague said earlier, they talked about all the points I was going to nail on, right? One of the things that I've learned at my facility is the youth having difficulties transitioning from foster care to independent living. That's usually extremely difficult for them to do. And like my colleague stated, one of the things I think that the gap that's missing is addressing trauma. I'm sure it's traumatic to go from foster home to foster home to foster home. Oh, I'm sorry.
Just bring it closer.
I thought loud in general. I think it's traumatic, and all the traumatic events from being in foster care to being homeless, and then all of a sudden they're in their own apartments. So that's what I face every day, is teaching everyday independent living skills. And also, as my other colleagues stated, to remove stigma. They have issues with talking about anything mental health. They say, oh, no, Selena, please don't do that. So I wanted to find ways to change the language so they're more accepting to their particular situations. And I think that's important, to change the language and to address trauma.
So I am a mental health specialist with the Forney Center, and we are an organization that provides services for LGBT youth ages 16 to 24. And our drop-in center is up in Harlem on 125th Street. So what we are really trying to do when someone comes in the door for us is be both trauma-informed and offer a harm reduction model. So that sort of starts when the person first comes into our drop-in center, and what does that experience look like for them? So that starts off with us being gender affirming, asking what the client's PGPs are, preferred gender pronouns, as well as what they want us to call them, what their preferred name is. So that really starts the process for them of understanding that this is a facility where their sexuality is going to be affirmed, their gender identity is going to be affirmed, and that goes a long way. So when a client first comes into us, they are assigned a case manager, a health counselor, and a mental health specialist. So we're really trying to be comprehensive in the services that we offer. And in terms of more of the mental health side of things, now we're at the point where every client is assigned a mental health specialist, so they have a therapist they can talk to. We also have a psychiatrist who comes in and does all the psychiatric side of things. And then also part of what we're doing is trying to provide psychoeducation for our clients as well as non-clinical staff. So when we see sort of trauma-informed behaviors, they're seen through that light and not through a more punitive lens. So we really try to address all those issues so when a client comes in, they can access our services, access the educational stuff, the job development, our transitional housing, trans housing, and really thrive in those environments. So I think as an agency, we've been really pushing a more trauma-informed perspective to help our clients really access and continue to develop in everything they need to do.
Hi everyone, my name is Kathy Wu. I'm from the Child Center of New York, from the Asian Outreach Program. Well, generally, the Child Center of New York is located in Queens, and we have a variety of services, from health homes and prevention, case management, mental health clinics. I'm specifically more in the mental health, behavioral health piece. And, for the Asian Outreach Program, again, we serve predominantly Asians located in the center of Flushing. So for our department, we have clinicians that speak over 11, 12 Asian languages. So we provide mental health and also substance abuse services, and a part of our work is also going out in the community to make our services known, because again, with a non-majority, a lot of the Asian population does not know that there are mental health services out there that speak their languages. And for us, I believe our biggest challenge working with the non-majority population, teenagers, is the stigma. And when I mean stigma, it's not much so like what the society views stigma toward our patients or clients who come in. It's more so the internal cultural stigma that the parents have. So a lot of our teens that we work with are second generation teenagers. They might not speak the same language, whereas the parents are the first generation, and they don't know English at all. And unfortunately, they might be working a lot. So when they think mental health For the parents do not understand why the children needs it, and our challenge is to educate the parents on it because it's kind of taboo in most Asian cultures that we do encounter, whereas most of the adolescents we work with are very much westernized and they're very open to mental health services while the parents are actually resistant. So, and predominantly too, like previously mentioned, we do have a population of teens that do come through the criminal justice system that we work with as well, more in the substance abuse program. But that's also a different challenge because it's more so for them transitioning them to mental health services or substance abuse services when they don't think the problem is actually there. So we do a lot of collaboration with the criminal justice system, parole, probation officers, and the courts to smooth that transition out for them. But overall, we do also go into the schools and provide parent workshops or teacher workshops or even student workshops when we get an invitation in the community so that we can also get the word out there about mental health services, and also just to let everyone be a little bit more sensitive to the issues or to the certain concerns that might be going on around the development age of a teenager, no matter if it is like immigration or like cause, or even if it's actual like stress with school, that they have some sort of support that's not only in the school or within the family, there's also community support as well.
So, thank you all for coming out and speaking with us today. We now have time for question and answers session. I have a couple of questions here, and I'll start. And this first question is for everyone on the panel. With social media being such a powerful tool to today's youth, how do you combat the harshness and stigma that can come along with being exposed to social media?
That's a good question.
Anyone?
Talk about it. I think that's come up, and it is certainly a campaign that we are working on at the door. It's helping young adults, teenagers and young adults understand that, how they're feeling or how they're responding or how they're showing up to places has to be unpacked. And talking about that in a way that is not shaming and that takes away and peels back really the feelings that come along with all sorts of things. The poverty in a non-majority neighborhood, trauma, separation from family, and also mental health in their own families. They may be experiencing their own mental health symptoms, but sometimes we have to really pull back the layers to figure out whether or not they actually are mentally ill or just experiencing so much compounded trauma that it just looks like mental illness. So I think when we do sort of this unpacking and this education, it gets people talking about it and saying it's more about wellness. And of course, we can use ourselves as models. We experience these things in our own lives. And I mean in an appropriate professional way. Mental health issues are experienced by every human being, not just young people, not just people from poor communities.
Well, I'm sorry. Because I work where the youth live, what we do is address bullying, because it is a sort of bullying on social media. So we run a lot of groups on how to, protect yourself on social media, whether it's Facebook, Twitter, Instagram, or whatever the other one is. I can't remember right now. But we do a lot of groups about how to protect yourself against bullying, and we also teach our attendants on how to protect each other against bullying. Another thing that I see is because, again, I work where they live, and everyone in the neighborhood knows what's going on in my building. So we also do a lot of community awareness, so it won't be that stigma or the bullying or let me be your friend on Facebook and to make fun of you. So we do a lot of that at my site. A lot of groups, a lot of bullying, a lot of language and community work also.
So, thank you. So, believe it or not, I mean, I mean, it's for us. It's not so much addressing like like I said again, the societal stigma of what's found on social media. We have a lot of teens that are suffering from anxiety and depression, not only on stigma, but also like just stressors from peers that are provoking for the mental health issues. And we just take it straight to the route. Like we do a lot of CBT actually in our therapeutic sessions to question them and challenge them. Like 20 years back or even 10 years back, we didn't have a platform that we use as social media it was so accessible. Then why we question it? Why do you need it now? So it's kind of like in a behavior perspective, we try to weed them off directly from social media so that it eliminate their predominant triggers, which is just unnecessary, and just they could just take it out if they could. So it's about controlling their own behaviors in being involved in the social media and the technology as well, and kind of just developing more healthy habits, like just going out in the community, talking to people. I have a lot of kids that do come in and they do not know how to socialize because they're on social media so much. So we kind of take more so that perspective in a therapeutic setting where we try to change behaviors and the thinking patterns to develop more healthy coping skills and remove triggers for them.
Yeah, I mean, I think for us, it's a really fraught topic because when a lot of our clients are coming in, social media might be the only form of contact that they have. So they don't have a computer, they don't have a phone, maybe their phone was stolen. So that is really like a lifeline for them in a lot of ways to keep communication open with peers, to let other people know they're safe, to let them know where they are, to contact family if that's something that they're open to. But then at the same time, we see sort of the more negative aspect of it, where shade and bullying and stuff that's happening in the space is then carrying over online and then sort of like circles back around into the space, and then fights happen and all these other negative stuff. So for us, it is something we're really aware of and try to be conscious of addressing how bullying and shade sort of like ripples out. And that happens in individual therapy, it happens in mediations between clients where this stuff is happening, and then also just sort of like trying to address it on a more like agency-wide level, that shade and bullying is not something that's going to be acceptable.
Thank you. We have a question from online. Do you have any advice for young people who are looking online for information and resources related to mental health?
I think again, this administration has focused in on mental health, and so I would say the New York City Thrive and also the New York City Well, because they give you some resources that are really usable and really accessible to New Yorkers and to young adults. And I do think that a lot of those resources are really grounded in trauma, are really grounded in anti-stigma, and in best practices. So I think that those are good resources and websites.
I mean, I believe for most of our agencies now, we all do have websites of our own. And I know my agency personally do have like a Twitter account, Facebook account, so you could find us there anytime. But again, I do support NYC Well. It has been helpful for me, even for referral sources. And another thing that I found very helpful is that, insurance companies, they're actually a really good resource because a lot of, I believe, clinics, any service providers, we do kind of surround ourselves with the insurance and managed care, Medicaid, all those policies. So if you actually just call your insurance or even go on your insurance website to like a Find a Doctor link, I'm sure it'll pop up that, it's a good resource to kind of locate where you want to have your services to be.
Okay, thank you. Our next question is, what can be done to deal with the various biases that exist within the mental health system?
for us, we did develop a piece of our program to outreach just for psychoeducation and get the word out there. And I'm sure, like, I've heard a lot of mental health blogs or mental health associations kind of coming together to actually provide psychoeducation as a community, so that the awareness is there. So in order to decrease the bias, I think it's just to actually increase the awareness and show that they're not alone. I think a lot of the times that a lot of teenagers or anybody in particular gets a little bit fearful and reluctant to access those services because they think they're alone. So it is very important that for us mental health providers to get together to kind of show the message out there. And again, it's great that Community Access is actually having a symposium like that, because this is and also with the live streaming technology, it's really helpful in terms of spreading the word too.
I think also being really direct about what those biases are, and calling out the connection between health and justice, or thinking about the what we could call the social determinants of health, the ways that injustice and discrimination are directly correlated to health outcomes, is super important. So really thinking about doing social work, doing public mental health work as being intrinsically connected to a type of justice initiative.
And I would just add that, then part of our job is helping our clients become shoppers, right? So becoming really educated and then savvy. In New York City, we do have a lot of services. So really finding the right ones for you that are quality services in a safe environment. And I think that helps also in working with clients to say, make sure that when you walk into an environment and it feels uncomfortable, that you don't need to return there, that you can say, this isn't a good fit for me. So teaching our clients to just become, just with their health literacy, I think.
Okay. One more thing, just in response to sort of teaching people about what they're able to do, choices that they can make. We're thinking about self-advocacy, and doing some education around knowing rights is quite essential work in addressing issues like you're bringing up.
We have another question from another online question. If you could wave a magic wand and change the way we talk and think about mental health, what would that change look like? It's the magic pill question. Mary, you want to start?
Sure. I would. It's wellness. I don't buy into the idea that when we talk about mental health as a society, we're putting it on the side and saying it's an unfixable, hideable, bad thing. I think that we're all infected by that, and our young people are, because of many, many compounded stressors and complex things. So, but we all know that, and this was brought up earlier, it's our healthy coping skills. Reframing mental health to say wellness, and what does that look like? Understanding that we might have financial problems, that doesn't make us, a bankrupt loser. We may have mental health stressors, but why are we not addressing it as this is our wellness, and that this is how we address issues related to wellness? And I think that is a goal to work towards, so that we're reframing it and making it an open conversation about how do we keep ourselves well.
So while I'm sitting here listening, the first thing that popped in my head, if I had a magic wand, what would I do different? How could I fix this? And it occurred to me is that we as providers need to listen more, really hear what the person is saying they need and their wants, right? We need to move away from the traditional where it's very authoritative and do this, do that, and give them room to decide what they want in their lives. If I had that magic wand, I'd give it some bigger ears to listen.
So another piece of it is just, when I think it's so much to change and like to narrow down as well, but I think predominantly for me, just working with the teenagers that I work with is just letting them know it's not that negative and it's not like really the end of the world. And when I say that, I don't mean to sound reprimanding or anything. It's more, I literally had a teenager come in and it was like, I have depression, I'm doomed. And I'm like, it's mostly a phase in life for a lot of people. And I believe everyone has their own stressors and everyone has their own problems. It's just whether your problems or stressors is impairing your functioning. And I think if it's becoming an impairment to your functioning, you have those additional support services like what we provide to kind of guide you a little through that phase. I always tell my teens that come in, my goal the day one you come in is to kick you out in a good way. So it's more, letting them become independent and self-sufficient and teaching them that they can master those skills on their own eventually. So it's not the end of the world. Everyone just feels mental health issues, mental illness is, my life is over. I'm forever going to be labeled that way. But it's not. It's mostly a phase in life. And, our position is to help you get through that phase in life so you can move on independently.
Yeah, I think what I started thinking about was getting people interested in their own psychological process and that process matters. And I think that's what we do as clinicians is validate people's experience. And that can really be one of the gifts of therapy is having this reparative experience, which so many of our young people have not had their entire lives. They've been constantly invalidated. And so I think giving people that sort of environment where the recognition is your feelings matter, you're being validated, your experience is being validated is really can be transformative.
Thank you. Our next question says, how would you counsel a youth who has a friend or family member themselves who's afraid of dealing with their mental health or gender identity challenges?
I mean, I mentioned it before about the stigma that we work with in terms of family members with the population and the cultural diversity that we work with. And mostly, I think when we do that, it's really about education and just trying to let them know that, for Asian parents particularly, they usually come in for academic reason, and we kind of do sell the point hey, they kind of have to work on this in order to strive on this, and eventually it's just kind of going with where the client is and going with where the parents is. And that's why we do kind of use a little bit of the cultural knowledge we have to kind of weed into that conversation to be oh, it's affecting the overall, and if you're able to accept this and focus on this, the child would be able to strive. So we kind of explain to them why it's becoming a barrier. And, again, I'm not saying every case is a success case, but predominantly we do have parents that are become very much supportive and understanding of why their children needs the services in the first place.
Was the question about somebody who has a friend who has
Yes, friend or family member
who is
Mentally ill or...
Yeah, mentally ill or having or afraid to disclose about their mental illness or gender identity.
Oh, okay. I mean, I guess thinking specifically about gender identity and somebody's questioning their gender identity, a way to approach it, I think, is by being as affirmative as possible, but also by recognizing the impact of transphobia and having some kind of awareness of what that experience might actually look like for an individual. So that the approach is sort of situated in such a way that there's some kind of understanding that the person is experiencing probably a whole lot of discrimination, self-doubt, isolation, and that those responses are to a type of like phobic response from the society at large, so that this can be sort of lifted off of the individual and understood in a broader context, I think is helpful.
You know, this is something that comes up a lot at the door. We have young adults that are struggling in their own world, but are living with somebody who is very seriously mentally ill or struggling with substance abuse and or mental illness. And oftentimes they are the caretaker for that adult and have been all their lives. So it's this very enmeshed, sort of warped relationship. So where do you start, and what would I say to that person? You know, what we do say is, okay, let's talk about you. You know, how does this show up for you, and where are the places where it gets almost unsafe, right? If you're doing things that are not good for you to support this person because they can't get the services because they don't want to address their mental health. So that's the first thing, is sort of the safety, and then I think really taking away some of the shame that, yes, right, this adult might be, or this friend might be mentally ill and struggling, and where's the balance there? How sometimes helping our young people that show up at the door and say, yeah, you know what, it's actually not good for you to be home all the time because it's not a healthy environment. So helping them begin to create healthy boundaries with these family members. And so that's a challenge, right? Because sometimes the adults are supported by these young people. So it's that developmental shift. And the open dialogue, again, sort of unpacks it, takes away some of the stigma. Yeah. Takes time.
Selena?
I didn't have an answer, but I can come up with one. Can you please repeat the question, please?
Sure. What would you advise a young adult who has a friend or family member who has challenges with mental health and or gender identity?
I agree with Mary. I first and foremost, I would see if this is a safety concern for them. First, with safety. But on another note, I also believe that if you're helping youth, you have to help the caregivers and the family too. Everyone, you can't work on the youth without helping everyone involved with this youth because it's for naught. So I truly believe that that we have to create a safe space. And again, to remove the stigma, change our language, make it seem normal, whatever normal is, right? And make it seem safe. That's what I believe, right?
I think just one more thing I want to put out there is a word we didn't mention: resilience. It's helping the child or people that have family members or friends with mental health issues as well that develop resilience. It's more sometimes I do agree that the first thing I go to too is just to help the family and everyone involved as best as we could. But sometimes the family members or the friend might be resistant, and there's just really so much we could do sometimes too. So it's all to come down to helping the client or helping the teenager develop their own skills and develop their own boundaries so that they do have the resilience to get through some of the uncontrollable variables and stressors in their lives. And it's unfortunate that's reality, but it's also something they have to be aware of too, that it's not all sometimes it's not all within their control or fixable. It's sometimes the acceptance and awareness of them within.
Mm-hmm.
Thank you. In your experiences, what are some of the special needs of immigrant or refugee youth?
Well, I think one of the things they have issues with is social isolation. They're socially isolated if you're immigrant or youth. So I think it's also important to do inclusion.
The door has a large legal department that deals with undocumented youth in New York City, and as you can imagine, it is overwhelmed at this point. What we see a lot of that we can't address is trauma. So a lot of new immigrants are bringing huge histories of trauma. They generally are coming in to get legal work processed and to get paperwork processed, but aren't able to access trauma services, sometimes because they just come in and they leave. They're really watchful of the door and they're trying to lay low. And sometimes because we don't have the capacity to provide that much intense trauma debriefing. And so it's a real gap, and it's a gap that we have private funding for our legal department because that's where funding comes from for immigration at this point. But so obviously not enough resources dedicated to that. It's real.
I mean, for the families that we work with, we work on a more therapeutic level, and I definitely support that term that there is something called immigration trauma, but I don't think a lot of people recognize it because I would have teenagers, they do have status here, but then their parents are at risk of deporting, and it causes so much anxiety. Sometimes it causes not only a psychosocial issue, but just internally for them, they can't concentrate at school. They get depression because they're worried that their mother might not be there when they go home. So for us, it's within the therapeutic process, we do try to develop a level of self-esteem and self-advocacy because, again, we're not dealing more with the legal kind of framework. We're more in the therapeutic framework, and I think it is very important that they do have that sense of self and identity, and they know the resources where they could go to and how to speak up for themselves if they do encounter that problem. It's kind of like they have a little bit of tools and weapons if they do encounter it, even though it is just more anxiety provoking, and it might, majority of the time it doesn't happen, but it's that self-securing kind of development for them.
Yeah, and it's obvious that bigoted anti-immigrant sentiment is at a peak right now in this country, and that must have a tremendous impact on the sense of security and wellness and safety of many young people, young students, incredible impact on mental health. So it just seems like something that's imperative for agencies like ours to be building capacity to address if it's not currently there.
Thank you. Next question. People in non-majority communities are more likely to have negative encounters with police. How can people with mental health concerns get the treatment they need before crisis?
I think this is something we experience quite a bit when people are having sort of acute psychiatric emergencies, and there is some balance that has to be weighed about the pros and cons of sending someone to the hospital versus what that experience is really going to entail for that person when the police come along with EMS. And if the person is reluctant to go to the hospital and the police are deeming them some sort of hazard, they're going to be dragged out of the building. And to see that is very, very traumatizing for everyone involved and really defeats the purpose of trying to keep this person safe. And it sort of seems like we're doing the opposite in a lot of ways when that happens. So I think for us, it's sort of working on a harm reduction level where it's even though a person may be experiencing psychosis, is it to the degree that they're, are we worried about them harming themselves or another person, or is it just making us uncomfortable that they're walking around talking to voices? So it's really weighing that balance and trying to figure out on a client level, like what is the best option for them. And then I think another thing that we try to do is have outreach to the local police precincts. So if we call 911 and we are getting police sent to our agency, they know who we are. We have some sort of relationship with them. Ideally, they're like respecting people's pronouns and identity. That doesn't always happen. But building those sort of like community relationships so that when we do need to access police help, it's not entirely traumatizing for everyone involved.
Okay, thank you. Our next question is for each of you on the panel. What would it take for your agencies to partner together with Community Access and other agencies in order to deliver an anti-stigma headstrong summit?
Let's do it.
No hidden agenda.
I think that's a great idea.
I mean, definitely. We're so happy to be here for the invitation as well. I mean, if there's any for us, because a portion of our work, like I said, it is outreach. So we do welcome any invitation or request to do any workshops or any, even coming here to the panels or to schools, just to educate and do a collaboration. I think that's very important to get the news out there and also get the awareness out there. So at any time, feel free, contact us, and then the collaboration is helpful and definitely a great idea.
Well, I already worked for the agency Community Access, but what I would say, what would it take? I think that it would take inclusion of the tenants or our youth to be a part of the summit, to get their perspective, to get their ideas, to see how it will benefit them. That would be my suggestion, of course.
Go ahead.
Well, I also already am here at Community Access, and I'd be grateful to be included in such a summit. And I'm just thinking practically about some of the things that we do at Blueprint that could perhaps contribute to such an endeavor. So thinking about stigma in school, I was mentioning earlier this issue of getting accommodations, and that many people who are eligible for an accommodation on in a college campus are not getting them because of stigma or because they're unaware that they could. So just doing some rights awareness type work, and then also some stigma management type work as well. So it's great to talk about what stigma is like and how we want to avoid that, but then recognizing that this is still a sort of part of people's daily lives, and what happens when you experience stigma, like how do you go about this? And so there's certain elements of practices that we have at Blueprint that we work with our students on to think about how to disclose mental health, how to talk about mental health conditions to either faculty at school or to your classmates. And we have worksheets that we do with people around planning a disclosure and thinking about who your audience is, what you want to say, how you're going to say it, and having everything worked out in advance and sort of anticipating what some of these negative reactions may be so that you can be prepared up front for what you might want to say. And we get really specific with people, including just having someone write down actually in quotes, like, if this happens, this is what I will say, so that people aren't sort of stuck in a moment and be like, I don't know, and end up saying more than they want, or like feeling really lost and ashamed. Yeah, absolutely. So these are things that I would think, Blueprint maybe could bring to the table of a symposium of that nature.
Listening to Justin, you're reminded of all the great programs and services that are out there that you don't know about. So the idea of bringing a forum together, a summit to capitalize on best practices and new practices and innovative ideas, I would say we should maximize the current administration, the de Blasio administration, that has made mental health a platform, and Gary Belkin at DOHMH. they will listen to CBOs, to community-based organizations. They are open. They are on it with mental health. This is a time that we should try to capitalize on that and bring together a summit and move the needle on some of the things that were discussed today.
Thank you. So mental health and substance use are very closely linked. What resources are available to help youth to attempt to deal with both issues?
So I'm actually the SAMHSA therapist at Forney Center, so I have a little bit to say about this. I think one of the things that we've really been trying to do at Forney is start short-term substance use counseling, so that people can sort of start having the conversation around what the substance use looks like, sort of where they're at in the process of recovery, working on a harm reduction level as well, and then also connecting people to resources. So there's a lot of really good resources at the LGBT Center. We work with them pretty closely. I'm trying to think of some other places right now, but yeah.
Well, our program in itself is a mental health and substance abuse program, so we do have a very integrated support there. For us, it's more so for our clinicians. We could keep the same client and just switch over the paperwork, but in general, I do believe the Office of Mental Health and also OASIS is working on more collaboration and getting on the same page, where it was like, let's just say a decade or two ago, they were very, very separate entities, and now they do understand that, there's most of the time it is co-occurring and people are self-medicating. So, and again, like insurance companies also support this, so I do recommend a lot of teenagers or even anybody with substance abuse issues, they could talk about it with their primary care physician, and insurance companies actually support that, and also probably give funding for doctors as well to make referrals to substance abuse now. So that's kind of a little bit component where there's a push as too. So that would be another resource route.
I would say that this is just another area that we separate out substance abuse, so that you'd have to go somewhere else to get your substance abuse services. So if you can integrate, as you're mentioning, if it's at your primary care office or at the door, things are integrated. So we also have SAMHSA funding, and we're working with 10,000 young adults a year. There's lots of self-medicating happening. There's lots of young people that may or may not go down a much more serious track into substance abuse. So how do we integrate substance use services into more places so that it doesn't become another place that you have to go to outside of, and you then have the luxury, hopefully, of doing more of a continuum, sort of the education, the psychoeducation, the harm reduction model. We partner with Arms Acres, who have young adult residential programs, and so that's right for a small proportion of young people we see. The rest of them are there's a lot of drug use, and it's the front end work. So being able to customize that and having somebody that can see somebody on site 4 times a week and somebody that can drop by a group once a week is sort of where a model I think we need to move towards.
All right. Well, thank you all for joining us here today. I want to thank our panel, Mary, Justin, Selena, Brett, and Kathy. Thank you all for coming today. You're done. Steve?
I was asked this. I did not plant that question about participating in a summit with community access, but I was looking at the sign saying New York City Youth Mental Health Coalition could be the next generation, and that as our Canadian colleagues, you maybe didn't hear their whole presentation, but the way it works, the only way it can work by engaging the students is you're also engaging the community resources. Because you get the students to start talking about these issues, they have to then take that someplace so that they can get support. If we form a coalition, I would, and certainly you would be maybe inaugural members I would invite, and we could begin thinking. In Canada, they do these summits in the fall, because that's when they give the kids resources and stories and ideas to then take back to their schools. And then they have monthly events throughout the year, which can involve speakers coming in, it can involve conferences, it can involve meetings and experts. So I want to thank you so much. This is a perfect ending for a day that I think was truly special for us. So thank you so much, and thank you all for coming, and thank especially my colleagues from Canada. It was really wonderful. Thank you.